I'm Mary Juris, and I'm a PM&R consultant here at Mayo Clinic. I'm also the chair of our Diversity and Inclusion Committee. I got involved in CERAB because my chair and some of my colleagues became concerned about the fact that often we would prescribe physical and occupational therapy to our Somali patients, and then they might not show up. My chair actually tried to reach out to that community and community leaders, but wasn't sure how to effectively connect, so brought this to me to pursue. I talked to a colleague in community engaged research, Dr. Joyce Ballsbury, and she recommended we submit the project to CERAB and get some input from the community on how to proceed with this. So I would point out that they have a really robust process for formulating your question and presenting it to the community, so that the board already has an idea of what your question is, and they already had some research ready at the time of my first meeting with them, and gave me some really insightful feedback to bring back. As the chair of our Diversity and Inclusion Committee, and also as a senior member of our department, I wanted really to engage our learners in this process of doing health equity research and quality improvement related to that, and to emphasize the importance of connecting with the community and learning what resources Mayo Clinic has to connect with the community, such as CERAB. And so after we had that initial connection, Dr. Witkowski became interested in the project and took over really, and did a phenomenal job. And we had several other visits with CERAB as the project evolved, which were extremely helpful, culminating really in us connecting with Somali Press, who were able to support our project, and otherwise we might have had a lot harder time with engagement in this.
Hi, I'm Julie Witkowski. I was a former physical medicine and rehabilitation resident here at Mayo Clinic. The presentation was very powerful because not only were we able to present our project and ask for help, we got feedback right there on the ground on the day of the presentation, and also feedback was collected from all of the members of the advisory board, including community stakeholders, and those were sent to us afterwards. Interaction with the CERAB board benefited our project significantly. Through some of the contacts that we made, we were actually able to meet with different community members and stakeholders within the Somali-speaking community here in Rochester. We were invited to the Somali Ramadan World Cup tournament, which was a soccer tournament that took place in Rochester. It was actually televised on local Somali TV, and we were able to interact with a number of the members of the community there, tell them about our project, and ask them for feedback. We also were invited to participate in the Refugee Walk Around the World Day community event here in Rochester, and were able to connect with community stakeholders there as well. Based on our interactions with the CERAB board and our community members that we met, we decided upon an intervention that would help improve, hopefully, these no-show rates to outpatient appointments. The intervention that we decided to implement was working with our Department of Language Services here at Mayo Clinic and training a Somali-speaking interpreter to call the patients that had upcoming appointments and provide them with patient appointment reminders, and also an ability to reschedule in their native language. Once we implemented that, we collected data over the next 6 months and went back and looked to see if the no-show rates to outpatient physical and occupational therapy appointments actually did improve. And in fact, they did. We showed a significant increase in our Somali-speaking patients showing up to their outpatient appointments. And we went on to submit this quality and improvement project and actually won the 2020 Excellence in Quality Improvement Award from our department.